Hi, I'm Dr. Elinor Hortle, and I research tuberculosis, the world's deadliest infectious disease. Every year, around 2 million people die from tuberculosis, and the drug-resistant form is rapidly spreading. That's why I use zebrafish to try to understand more about how this deadly bacteria survives, so we can come up with better ways to kill it. The reason I use zebrafish is that in the first week of their life they're transparent. This means I can light up their immune systems with fluorescence, infect them with a bacteria that's closely related to tuberculosis, put them under a microscope, and just watch what happens. When I did this, I noticed something surprising. Platelets, the cells that form blood clots, were showing up at sites of infection. They weren't forming clots, but they were interacting with the bacteria, and with a few more experiments I was able to show for the first time in vivo that the platelets were actually being recruited by the bacteria and were helping it to grow. This opened the exciting possibility that I could take antiplatelet drugs like aspirin, which are cheap, safe, and easily available, and use them to treat tuberculosis. This works really well in zebrafish, where I've shown that aspirin and other antiplatelet drugs can reduce the severity of infection by half. Even better, because of my research and other research in this area, scientists have started asking whether antiplatelet drugs can work the same way in humans. And just last month, a study came out showing that yes, aspirin can increase the survival of people infected with tuberculosis. I'm so excited to keep working in this space, and I know that the more we learn, the more we'll be able to improve outcomes for patients.